Bismillahirrahmanirrahim. So today we are going to study about the gastroesophageal reflux disease. Gastroesophageal reflux disease. So it can be defined as the excessive reflux of the acid from the stomach and is mainly due to the reduced lower esophageal sphincter tone or the increased intra-abdominal pressure, which results in the inflammation of the lower esophagus due to the damaging effect of these acids. Normally, this reflux or the gastroesophageal reflux occurs in the healthy individuals, usually after the meals or in the early pregnancy, and this reflux does not cause any damage. It is due to the submucosal glands which secrete the mucin and bicarbonate, which neutralize the acids and prevent the surface epithelium from damaging by the acids by the mucin, and second by the high lower esophageal sphincter tone, which protects the lower esophagus from the reflux of the acidic gastric contents. So these two are the protective mechanism which helps in the prevention of the gastroesophageal reflux disease. Now, what are the conditions which lowers the gastroesophageal reflux tone or the increase of the increased intra-abdominal pressure? They all contribute to the GERD, and the risk factors include like the alcohol, the tobacco, caffeine, and the fat-rich diet. All these belong to the food categories. Also, the increased gastric volume, obesity, and the pregnancy, which increase the intra-abdominal pressure. Also, whenever there is hiatal hernia due to any defect, due to congenital defects. What is hiatal hernia? It is the gastroesophageal junction is displaced upward as gastric cardia slides into the hiatus. For example, this is the esophagus and this is the stomach. This is the gastroesophageal reflux, gastroesophageal junction, and this is the diaphragm. Now, whenever there is defects in the hiatus, this gastroesophageal junction goes upward through the hiatus into the thorax. This is thorax, and this is abdomen into the thorax, and it can increase the chances of the risk factors for developing the GERD. The other risk factor is the scleroderma, which is the hardening of the skin connective tissue. It can also be caused by the persisting vomiting, the surgical vagotomy, because the vagus nerve supplies the submucosal glands. And this submucosal gland secrete the mucus and the bicarbs. So the surgical vagotomy will cut down this vagus nerves, which will do what? Decrease the function of submucosal glands, and there will be decrease in the mucus and bicarbs. Also, the recumbent position can also precipitate the gastroesophageal reflux. Now, what are the clinical features? So the clinical features are in the form of heartburn, which is the most important one. Heartburn, and it can mimic the cardiac chest pain. Asthma, which is adult onset. The child onset asthma is mostly allergic. And the cough, damage to the enamel of the teeth, and it is due to the reflux of the acids. Acids cause the damage to the enamel. In ulceration with strictures and the Barrett esophagus are the late complication, and this Barrett esophagus is the most important one because it can be a risk factor for the development of adenocarcinoma later. Now, what are the morphological features of the GERD? So we can see grossly as the red erythematous soft mucosa, lower esophageal mucosa, and this bleeds on the touch. We can also see in advanced cases the nodularity, the strictures, ulceration, and the erosions at the advanced stages. Microscopically, we see two basic features. Number one, there is basal cell hyperplasia, and the second one is the deep elongation of the papilla. In inflammatory changes like the infiltration of the polymorphs and the eosinophils, and the eosinophils are the most important one, In the early stage and later or in chronic stage, there is lymphocytic infiltration in macrophages, and this can lead to the fibrosis. Here you can see this is the papilla, and there is elongation of this papilla, and it can reach up to the surface epithelium. Here also, this is another picture. You can see the thickness of the wall of the lower esophagus, and here you can see the basal cell. The basal cells layer, and there you can see hyperplasia of the basal cells. So that's was the lecture regarding the gastroesophageal reflux disease. So that's all for today. Thank you.